you've got everything you want, and your vacancy, but you don't get me. You don't get me.
Hi, my name is Drew Pearden, and I have high-functioning autism. So for what should be obvious reasons, I'm very invested in this whole anti-vaccine hysteria. In that I hope to help put an end to it, because of the tragically preventable deaths and suffering it has led to. Now, I'm not a doctor, I don't know much about medicine, and I haven't studied medical science, so I'm not gonna go into detail about how pretty much every anti-vaccine claim has been scientifically disproven. No. I'm instead going to use simple logic to disprove the one argument that anti-vaxxers always seem to fall back on when they're confronted with dissenting evidence. The argument that the pro-vaccine side is part of a conspiracy perpetrated by Big Pharma to lie about the risks of vaccines, that all of the doctors and journalists are paid off to stay quiet, so Big Pharma can continue to make money off of administering vaccines. Now, I'm not in any way saying that you should always trust the word of pharmaceutical companies. In fact, I totally understand mistrusting most corporations. After all, profit is their number one motive, and most of them have been known to lie to us in the pursuit of more profit. But I object to this anti-vaccine argument not only because of how unprofitable vaccines are, but also because this whole idea is not really about mistrusting Big Pharma, or rather, not just about trusting Big Pharma, but I'll get to that later. Now, first of all, this whole argument hinges on the idea that Big Pharma makes so much money off of vaccines that they're willing to cover up allegedly horrible side effects in order to protect their profits. This is not the case at all. In fact, drug companies in general aren't really making that much money, and in fact, most of them are struggling financially. You can Google pharmaceuticals downgraded for mountains of evidence on that. This is mostly because of the tons of money they sink into research, development, testing, and most of that money ends up getting squandered on drugs that never make it to the market because they're proven to be ineffective or dangerous. Then they have to get approval from the FDA, market it, and get doctors to prescribe it, and hopefully they'll make some money off of it, but they're pretty much guaranteed for a huge financial downfall once their patent expires, and pretty much any company can make a cheap knockoff. And a lot of this is much worse when it comes to vaccines, because contrary to what most anti-vaxxers want to believe, vaccines are actually among the most scrutinized and heavily tested of medicines. They have to ensure that most recipients will get an immune response without contracting any symptoms, so they'll have to determine if it's necessary to keep the virus alive or not, how they can keep the virus alive long enough, but whilst also making it unable to reproduce, and also the exact dosage and amount and kinds of chemicals needed and preservatives needed to ensure all of that, without, possibly harming the recipient. And once they do make it to market, they barely really have a chance to make back their money, because even if we factor in things like booster shots or re-administrations, a vaccine is likely to be given like 1 to 3 times in a patient's entire lifetime, as opposed to, say, an antibiotic that needs to be taken once a day. Also, the whole point of a vaccine is to make a patient immune to a disease. I mean, sure, they don't work for everybody, and even when they do, they aren't always 100% effective, but ideally, that's what they're meant to do. And if people are immunized from a disease, they won't get sick as much, and therefore won't require as much treatment, and therefore won't give Big Pharma as much money. The more I think about it, wouldn't it be more profitable for Big Pharma to discourage vaccinations? I mean, if they're really just about making money, wouldn't they want people to get sick more often, so they'll have to buy more treatments from them? Just a thought. And again, none of this should suggest that Big Pharma is trustworthy, because they've reportedly done some pretty shady stuff in pursuit of profit. They've renamed and repackaged drugs to prevent their patents from expiring. They falsified research. They insert paid shills everywhere, and they've been known to bribe entire governments in order to ensure a majority market share in foreign countries. But honestly, I find it hard to blame them for any of that, because of how little money they're making anyway, so I can understand them taking such routes in order to make more, to hopefully recoup some of their costs. But why am I pointing all this out if it just seems to weaken my case? Well, because I know about all of this, thanks to journalists and corporate watchdogs who report on all of it. And yet all of them have been silent on Big Pharma covering up the dangerous side effects of vaccines. Now, you can argue that they were paid off to stay silent, but if that's the case, why wouldn't Big Pharma pay them off to stay silent on all that other stuff? Why would they want them to why would they bribe them to stay quiet about certain things but not others? And for that matter, most doctors are aware and are open with their patients about some of the side effects of vaccines. So again, why does Big Pharma allow doctors to tell their patients the potential side effects of some of the potential side effects of vaccines, but pays them to stay silent about others? But just for the sake of argument, let's assume that Big Pharma is paying off doctors and journalists in order to protect their minuscule profits from vaccinations. I mean, even if it is just throwing away more money that they'll have a slim chance of recouping. I mean, after all, it was nothing less than Machiavelli's The Prince that stated that you can get away with being dishonest as long as you lie about how dishonest you are. But here's the question. How many people would they have to pay off? Bear in mind, over 99% of doctors claim that the benefits of vaccination overwhelmingly outweigh the risks. So, therefore, pretty much every single one of those doctors must have been paid off by Big Pharma to say that. I mean, the less than 1% of doctors who claim otherwise none of them have put forward stories or any claims that Big Pharma attempted to pay them off or told them to stay silent. So obviously they weren't receiving such bribes. So everyone else, but all the other doctors, if the anti-vaxxers are right, all those other doctors, they must be. And that's like, what, several hundred thousands of doctors all paid off to stay silent. And what about all those journalists I mentioned before that parrot this claim? I mean, Wired magazine, Skeptic magazine, Huffington Post, Washington Post, just to name a few of the hundreds and hundreds of publications that have supported pro-vaccination and condemned the anti-vaccination hysteria. I mean, they must be getting paid off as well to cover this up. Both the writers and the editors, which would add millions more people having to get paid off. And in addition, what about the friends and family of those aforementioned doctors and journalists who suddenly notice this unexplained payday, or this unexplained bonus? And for that matter, did none of their colleagues question them about it? I mean, doctors and journalists do tend to be the curious types, you know. And also, what about the IRS or other tax agencies? I mean, wouldn't they want to investigate this to collect income tax? Wouldn't they be worried about fraud? Wouldn't they want to track wouldn't they want to track all the tax files on this? Would that not leave a trail? But again, I'm sure there are anti-vaxxers out there who will claim that all of those people are paid off to stay silent as well. I mean, why not? I mean, we've got the checkbook out anyway. Now, this brings me to my main point. Every single one of those potentially millions of people who were offered this bribe took it. Every single one of them, 100% of them, without exception. Not one of them refused and came forward. Or took the money and came forward anyway. I mean, we didn't hear about any doctors or journalists running to their news outlet, waving a check, going, "Hey, Big Pharma gave me this check to stay silent about vaccines. Can you believe those assholes? Print this ASAP." Nobody came forward, despite them allegedly covering up dangerous and debilitating side effects. Despite the chance to probably receive a Pulitzer or some other award for saving us all from the biggest medical scandal and conspiracy ever, that of Big Pharma's plan to poison us all with vaccines for money. None of them came forward despite all the aggrieved families blaming vaccination for their children's suffering, or the doctors who were cut off from the medical community for supporting such claims. None of them came forward for their sakes and told them that the whole thing, what they were claiming, was true, and it was all part of a sham, and it's all because of this big constructed sham. So essentially, this whole entire Big Pharma conspiracy theory hinges on the idea of pretty much everyone who isn't anti-vaccines being either demonically evil or a mindless sheep. And that, in a nutshell, is the problem I have with these sorts of conspiracy claims. It's because they're not based on a belief in corrupt governments or corrupt corporations. I mean, heck, we all believe that. It's because they're based on a belief in a corrupt everybody, basically, except for you and your fellow anti-vaccination people and a few of your brave friends who stand up to those evil doctors with their hard-earned PhDs and their empirical evidence. It's the same mindset that informs several other conspiracy theories, like many of the 9/11 conspiracy theories, JFK, the moon landing, the Illuminati. Now, I totally understand the attraction of that mindset, because it simultaneously justifies inaction and makes you feel special without having to actually accomplish anything. You make yourself seem better by making the rest of the world out to be rotten, and make it seem pointless to try to change it because of how insurmountably bad everybody else in the world is. It fills one of the most basic and common human psychological needs, and I admit I've been guilty of this kind of thinking on several occasions. But another big problem is that it also distracts you from the real problems in the world that you can actually do something about. Like all those things I've mentioned that Big Pharma really does do. Or actual corruption in other governments and corporations, like the NSA spying on everybody through cell phones, or the broadcasting corporations out to end net neutrality, or all the continued persecution of religious minorities in various countries. It also diverts time and funding that can be used to solve actual problems towards debunking said claims, like the hundreds upon hundreds of studies that debunk the vaccine autism link, all of which have pretty much fallen on deaf ears and haven't stemmed the over 136,000 preventable illnesses and about 1,400 preventable deaths that are all a result of people not vaccinating. You can check out the website Anti-Vaccine Body Count for specifics on that and some further reading. So people are dying because of this claim, and which is to say nothing of the horrible message it sends to autistic people and to their parents, basically by suggesting that it's better for them to die of measles than to live with autism, which I have learned how to do. And I can understand that you can claim that that's not really what you're trying to say, but nonetheless, I'm afraid it comes off that way. So I'm sorry. Oh. A check from Big Pharma arrived.